Hi, I'm Dave Esposito. I'm a surgeon here at the Milford Vascular Institute. Today we're going to talk about the first in a series of what I like to call the silent killers, which are basically vascular diseases that won't show any symptoms until it's too late. It's real important that we are aware of them and aware of things that we can do to prevent them and diagnose them early. The first is carotid artery disease. Carotid arteries are arteries that connect your heart to your brain. When you get atherosclerosis, which is hardening of the arteries, when you get atherosclerosis in the carotid arteries, it increases your risk for having a stroke. The dangerous thing is that as the amount of blockage in the carotid artery increases, you won't have any symptoms. The first symptom you'll have is when you actually have a stroke or a mini stroke, and by then it can be too late. The important things about carotid artery disease are first prevention. The way we prevent carotid artery disease is the way we prevent any type of atherosclerosis. The best way to act against that is by controlling risk factors. The number one risk factor is smoking. Obviously, smoking cessation goes a long way to limiting your risk. The other things are controlling your hypertension, diabetes, controlling your cholesterol, losing weight, managing your stress. All those things will decrease the risk factors of getting atherosclerotic disease. Specifically in the carotid arteries, studies have shown us that once we get 60% or more blockage in the carotid arteries, that's when our risk of stroke starts to go up. So the question is, when do you know that you've got 60% or more blockage? And really the only way to know is with a test called an ultrasound. The good things about ultrasound are it's a very simple, quick test. There's no radiation, there's no pain. It's done in a doctor's office by ultrasound technicians, and it's very accurate, can tell us exactly how much blockage there is. The problem is that you have to get referred to get an ultrasound, and sometimes insurances may not pay for an ultrasound if you're not having any symptoms. It's very important to get a screening ultrasound exam. Now, sometimes you can ask your primary care physician to send you for an ultrasound. There are screening services around. At Milford Vascular Institute, you can call us and come in and get screened. Again, it's a simple 5-minute test where we can look at your carotid artery and see if there's any blockage or not. Call up here at Milford Vascular, we can do your screening ultrasound, ask your primary physician if you can get a screening ultrasound, but whatever you have to do, control your risk factors and get an ultrasound today to make sure you don't have this silent killer inside. Take care, have a good day.